I believe that chronic care management is a meaningful, commonplace way to lower patient costs and as a conservative solution, provide higher standard of care for seniors with chronic care needs. That's why I introduced the Chronic Care Management Improvement Act of 2023 with my colleague, Congresswoman from Washington, Ms. Delbane, that removes cost sharing for chronic care management services under Medicare. As our national debt grows and our population ages, I believe investing in Chronic Care Management Improvement Act will ultimately save money for both seniors and the American taxpayer. So Dr. Dagestani, is that right? In your written testimony, you state APG's member groups are committed to engage in the full spectrum of APM and Medicare Advantage. In your experience, in both your role with APG and as a practicing physician, how would chronic care management services benefit your physicians who are members of your organization?
Thank you for the question. So 80% of Medicare spent is probably spent on 20%, which is usually the chronic disease management. And really to do disease management well, chronic disease, it's team-based care. A single physician cannot achieve that objective alone. You have to partner with others, you have to invest in population health, and you have to build a system around the patients. And that's a significant investment. A few examples from APG members and from my group as well. Again, we take care of about 55,000 Medicare patients, about half of them under MA in a capitated prepaid model, and half of them under an ACO with Medicare. We have a pharmacy team, we have a home visit team, we have care managers. We're partnered with a home health, partnered with hospice, and partnered with a hospital, and partnered with certain specialty group to be able to build, the system. So being able to provide chronic care is critical. Getting primary care as well is as important, even though it's 20% of the spend, but every extra dollar spent there can prevent the need to spend a lot of dollar on chronic care as well.
Yeah, absolutely. According to HHS, only 4% of 22 million eligible Medicare patients partake in chronic care management services due to the current payment structure. So Ms. Pittman, in your written testimony, you stated that Congress should encourage Medicare Advantage plans to enter risk-bearing arrangements and APMs that encourage more value-based care to help manage chronic care illnesses and quality access to care. So how would eliminating the chronic care management cost-sharing requirement under Medicare impact APMs and the quality of care given to each patient that are primarily seniors?
Yeah, so one of the things ACOs do currently is offer the chronic care management outside of billing for it because of the cost sharing piece. And so one of the things that we'd want to see as an additional flexibility for ACOs is to be able to waive beneficiary cost sharing. So our members are doing risk arrangements with the MA plans, and then they're in ACOs. In the MA plans, they're able to provide that chronic care management without cost sharing. If they do it in an ACO and want to get paid for it, then they have to, then the cost sharing comes in, or they just provide it on their own and don't bill for it from their shared savings, or this is another way that they use those advanced APMs. So eliminating the cost sharing, giving ACOs more flexibility to waive patient cost sharing just opens up the flexibilities and what else they can do and continue to innovate and provide additional services.
I agree. So I'm hopeful that my colleagues on Energy and Commerce Committee will consider the Chronic Care Management Improvement Act as a way to lower patient costs and improve health outcomes for our seniors. So great answers. Appreciate your feedback. And with that, Mr. Chairman, I yield back.